market.
And
we can't produce enough. And this all, you know, price control. So nobody produces enough.
And it's the same for any epidemic, you know, whether it's malaria, whether it's dengue, whether it's anything. Whenever an epidemic breaks out, cholera, we're always short of drugs. And you're very right. I think it's really about the fact that the government planning machinery doesn't work well. Their stocks are either expired or there are no stocks. In fact, one of the things that also comes to my mind is that they're almost expecting the private sector drug industry to really support this whole disease challenge in this infectious disease area, whereas it is actually fundamentally a government responsibility. And therefore, as you rightly said, if they want us to play that role, then incentivize us.
I mean, I would do the other way around, like Mumbai city. I've been moving stocks from Bihar for malaria, you know, thinking, okay, where is malaria occurring in our country? And it's impossible for a private company to look at that as a whole, a country as a whole. So the government has to play its role to track the epidemiology, to see where is needed, and then, you know, tell us, and we'll support the government every way. But fundamentally, we need to change our laws. Yeah. And if we can do that, I think it would be a very big first step.
So you're saying instead of controlling the price and making it so rock bottom that you can't even afford to do anything in terms of either disease awareness or even
education,
in terms of
distribution,
or or even sort of reaching it out to the rural areas, because it's expensive to do that. You should actually, government should be incentivizing the industry and allowing us to basically spend and invest in these kind of activities that will provide the access.
Yeah, prevention of malaria, prevention of anemia, prevention of tuberculosis is much cheaper than the cure.
Absolutely.
So why not? Have you ever seen an ad of these? No, because no one can afford it. So we need to actually do it.
And the government is not doing its bit either. You know, I mean, they can be doing this advertising and awareness creation, but they also don't have the requisite funds to do that. So, I mean, if they could partner with the private sector, and it's a very effective way of doing it. So, I think it's something that the government really has to think about, you know.
I was in the US, Kiran, in the last few months, and I was amazed at how behind we are for really basic quality of standard of healthcare. I felt the nursing, you know, is much poorer here. The doctor's availability, just because the sheer number of volume of patients that he has to deal with, he doesn't have time to answer patients' questions and so on. So we have to really improve. We cannot be a global superpower if we are so behind in our healthcare.
I think there are 2 or 3 challenges the way I see it, Swati. One is, of course, the scale up issue. You know, we need scaling up the human resource element in healthcare. So it's not a, you know, we're woefully short of the number of doctors, nurses, paramedics and technicians. So I think that is one challenge, is how do we scale up in terms of human resource, and it's about low quality human resource. We don't want someone who's just very, you know, educated in a basic way. We need a trained person, we need a skilled person. So skill development and skill building to that, you know, base is very important. The second thing that we have to really focus on is standard of care. There is no standard of care. You know, there is no standard of care, there's no standard of even treatment costs for that matter. A patient has to almost shop around for the best rate. You know, I think at least in a national health system, there has to be a cashless element. You know, that's a big challenge for us. How do we make sure that any elective or any emergency medical treatment has a sort of a harmonized, standardized treatment regimen, a cost base, so that you can actually start evolving a healthcare system that the insurance can support and that the private sector can afford to, you know, also support.
You and I have been saying that the cost of pharmaceuticals is only 10% of the cost of healthcare, and very little focus on getting efficiencies, quality, management thinking, you know, accreditation in that 90% cost. And if we can apply good modern management to all this, I really think that we can improve the standard of care dramatically. We have 1 billion people, we have talented young people. If we get the right training, India can be the medicine maker of the world and the medicine provider of the world. How do we achieve that global standard?
India's poverty and medical talent is a perfect cauldron for innovation in our healthcare industry. And care providers like Piramal Healthcare's Swati Piramal are only too aware of that. Swati, a leading woman entrepreneur who drives all the R&D work at the Piramal Group, believes that the government can do a lot more to give an impetus to the private players. Public-private partnerships are a step in that direction. But really, a lot more needs to be done.
There's also a thinking now that, we need a sort of a clear demarcation of roles, What does the government need to do in terms of its role play in the healthcare story or the healthcare space? What is the private sector's role? And, one thinking is that the private sector should be the healthcare provider and the government should be the healthcare insurer, or at least, some semblance of that kind of model. You can have top-up of insurance coming from the private sector, but at least basic healthcare should be covered through an insurance model that is provided by the government. And then, of course, the whole private sector hospital networks, in the government hospital networks are then brought into this whole system to provide the healthcare. But, we all know that the government hospital network is suboptimal. So a lot of people turn to private sector.
No, Kiran, let's face the facts. In 10 years, some villages have never seen a doctor. There's over a lakh of villages which have no doctor, forget about hospitals. And we did, the Piramal Foundation does a program called E-Swasthya in about 100 villages in Rajasthan. And we tried to connect a telecom network, and with TCS we made software. But the laws are such that actually you cannot write a prescription on the phone. So first of all, we need to, how on earth?
And can we get technology?
We need to use technology. Today technology is available. And if we can provide the basic modicum of healthcare to the villages which have no doctor, just simple antibiotics, painkillers, even that would take away quite a bit of the burden. But again, as I said, our laws are done before independence, before this new technology was ever available. And we must use technology. There is no other shot.
No, even immunization. What is happening today is that many immunization programs require, 2 shots and 3 shots of vaccines. You give the first dose and then you give the next dose after 3 months and the next dose maybe a year later. Now what is happening is that you give the first dose to a village, say for instance, and then when you come back 3 months later, many of those villagers might have migrated elsewhere and they miss their dose. A year later, you don't know how many more would have migrated, and so you don't have a track of how many people have actually completed a proper immunization cycle. So government is wasting its investments in immunization programs because of this. And today with technology, you can actually track, this migration or these migrants and actually make sure that they are immunized.
Actually, I started my career very early on that premise, because we were running mills in this area where you're sitting is in Parel in Mumbai, and migrant workers used to be textile workers, India's oldest industry, and their children used to get polio. So I started a no polio zone here in a 10-kilometer radius as a young medical student to vaccinate people against polio. And I'm proud to say that now today there isn't any polio. But how can we replicate this experiment in every village in the land? That's what is really vital. If we are to become a global superpower, we cannot do it if our healthcare is so poor.
I think, the concept is, the primary health center concept was very good, but most of them don't work. They are totally dysfunctional. So I think there is a need to have primary health centers, secondary health centers, and then linking into a tertiary healthcare hospital. And now we have to look at how we can actually then get into the rural areas and create access for patients, and therefore it helps our business grow.
So I think it's just using technology and more technology, and I think really while you say there's an opportunity, we have to move with speed. We all say there's an opportunity, but how can we use time to be on our side, because other people are running much faster.
So I think that's what is required for all of us to address this healthcare challenge. Swati, thanks so much. I really enjoyed talking to you. I always enjoy talking to you.
So do I.
But I think this is a special episode on healthcare, and you know, I think people like us,
both passionate about it.
No, and I think it's important for people like us to get involved in this mission, because like you rightly said, if India wants to be a global leader, without good healthcare we cannot be that. Thanks a lot.